Hello, good evening, and this is In the Public Interest. I am your host, Linda Johnson. I'm very happy to be with you this evening. And April is Cancer Awareness Month. And I'm very happy to say that for the month of April, we are going to talk about this evening breast health awareness and breast cancer. And my guest this evening is Charles B. Simone, Dr. Simone, who's been kind of like a regular on the program, and I love having you. Welcome, Dr. Simone.
Thank you very much, Linda.
Okay, April is Cancer Awareness Month, and in particular, I believe it is this week. I could stand corrected, but I believe this is Minority Cancer Awareness Week. So I'm very interested in focusing tonight on the African American woman, in particular with breast cancer.
Sure.
I am a 16-year breast cancer survivor, and although I talk about all these other cancers, of course, that's near and dear to my heart. So tell us a little bit, Dr. Simone, what are some of the disparities between the African American woman and the Caucasian woman? Because I know there are some differences.
Well, first of all, 2 of every 5 Americans will develop cancer in our country. And the rate of cancer has increased. 60% of all cancers are nutritionally related. What we eat is causing 60% of cancers for women, 40% in men. So we have control over the most important risk factor. We know that the breast cancer rate has been increasing dramatically. In 1960, 1 in every 20 women got breast cancer. Today, it's 1 in 7 women will get breast cancer. And that number is higher for African American women. African American women get about 25% more cases than the Caucasian, and that the death rate for them is about 25 to 30% higher also. So there's a major disparity. There's more cancers accruing at later stages than in the Caucasian.
Now, I know that one of the hats that you wear is that you are a researcher, and I've read every chance I get, I read articles about breast cancer, in particular with African Americans. And I noticed that African American women seem to develop tumors at a younger age. Is there any research currently kind of talking about that?
Genetics has little to do with cancer of the breast. Maybe 7% of all breast cancers are related to genetics. So most of what we're seeing is what's happening to our own bodies by ourselves. What we see is the major risk factor is a high-fat diet, low-fiber diet, a fiber that is low in vitamin mineral intake, and we'll talk about the prevention, and we'll talk about that to treat for longer life as well. So that's the major culprit. The second major culprit in causing of cancer in general, but specifically breast, is tobacco. Third is alcohol. Remember, 2 or 3 drinks a week, not a day, 2 or 3 drinks a week is enough to give a woman a 250% higher risk of breast cancer. Other things, hormonal issues. If a woman used birth control pills for 4 years before age 21, they have a higher risk of breast cancer by a factor of 200%. So 4 years of birth control pills before age 21. If a woman had a miscarriage or an abortion first time around, the risk for breast cancer is 200%. So we're seeing all these factors coming in to cause the cancer. Yeah.
Now, I also read an article that seemed to indicate that we, as African American women, tended to have larger tumors than were seen in Caucasian women.
Right.
Is there anything?
I think that's mainly the fact that the mass is ignored a little bit longer.
Okay.
They're less apt to go into the doctor when they feel a mass, or perhaps they don't examine their breasts. And we need to talk and stress about self-examination and also mammograms, and we'll talk about that soon.
Now, the other thing I like to bring up is because I was a woman who was under 40 who was diagnosed, but I had a family history. But I also know that another myth that is going around in the African American community, or is it a myth, that African American women are a little less likely to develop breast cancer after the age of 50?
That is true. Than the Caucasian, yes.
Is there some scientific basis behind that?
Overall, there's less breast cancer in the African American woman compared to the Caucasian. The problem is the African American woman waits longer than the Caucasian, so they come in with a later stage
Okay.
than the Caucasian woman.
Okay. So they say that 44%, I read an article, 44% of breast cancers found in African American females have spread to other areas versus 35%. Is there something with the aggressive factor?
No, not necessarily.
Okay.
The fact is this: the larger the tumor, the higher the likelihood of the mass spreading from the breast to the lymph nodes and other organs. So,
And that's systemic.
and that's simply time. The longer the breast mass is inside the body, the more time it has to spread.
And of course, I know the age-old myth that African American women experience a higher death rate, and I know that that's
By a
usually,
factor of 25 to 35%.
and part of the reason that we're talking tonight is to hopefully curtail some of that. But isn't that mostly due to a later stage?
It
of
is.
diagnosis?
The later stage, the less likely that the woman will come in to seek help when they find the mass and they prolong it, procrastinate it. So we need to educate women earlier about examining themselves sooner, getting the mammograms sooner, and coming to see the doctor sooner than what they're doing.
But now, are we in agreement that are there disparities
Yes,
when
there
it
are.
comes
There
to
are.
the African American woman and Caucasian or other women?
Yes, I think the disparities can be taught away. In other words, we can teach the African American woman
Okay.
to become more educated about what to do about their breast, and I think we can see disparities fade away. But we need to educate people.
So, do you think this is more of a lifestyle change?
It is.
Okay,
It is.
since
Lifestyle, cultural. We need a more proactive program, a program that you coined, the Confident Woman.
yes, and he's the best straight man that we have working with us. Dr. Simone and I, along with some other community partners, which
And
I'll name,
WIMG.
WIMG, and I
Mr.
want to
Morris.
thank Morris Broadcasting. We have developed the Confident Woman program. And I don't know, Dr. Simone, you want to give a little overview of where we're going and what we're planning?
Well,
some
the
of things?
confident woman, and you're going to speak to this more. The confident woman is to provide the education necessary to a woman by us going into the organization, whether it be faith-based or otherwise, and teaching the woman what to do, how to examine themselves, what to do to get more information, how to get mammograms, and how to navigate through the whole maze of the healthcare system. And why don't you talk a little bit about that?
Well, actually, Dr. Simone and I came up with the idea, and we ran it past Mr. Morris a little bit, because Morris Broadcasting has been just so instrumental in helping us get the message out. The Confident Woman, I actually kind of coined it from Hebrews chapter 10, verse 35. So do not throw away your confidence. It will be richly rewarded. And I did the definition of what confident was. You have to be self-assured, certain of having the ability, judgment, and resources needed to succeed, convinced, sure about the nature or facts of something, and excessively forward, bold, and presumptuous in your manner. And I think that when I read that and read the definition of it, I just felt, you know what, we're going to go in there, both barrels blazing, and we're going to give the community some of the facts that they needed. We're going to arm them to do this fight against breast cancer. So many women, we originally thought about doing it here in the Trenton area, but I think we're going to expand it. I think we decided to do central New Jersey
For now?
for now,
Uh-huh.
and we are willing to travel.
Yeah.
So why don't you tell us a little bit? I know Simone Protective Cancer Institute is going to be involved.
Right.
And some of the ideas that we have, how we're coming in, we're going to do with education and some of the things
Sure.
we're going to offer.
Well, we want to go into the organization, get information, get background information on the women, contact information. It'll be all private. Nobody will be able to get the information from us.
Right.
It'll be very confidential. We will then educate women about what they can do to help prevent diseases. And that's an important thing, prevention. And we have a whole program for children about prevention, as you know.
Yes.
We then, after we educate about prevention, we'll talk a lot about detection. And that's the key, how to detect it. Because we need to detect these things earlier than what we're able to do now and what the African-American woman has been doing thus far. So we need to do that. So we will talk to them about many things that I wrote here in the book, The Truth About Breast Health, Breast Cancer. We will talk about breast self-examination. We will talk about mammography, and importantly, physician examination. So the self-examination, everyone has heard about for a long time. We want to give out a brochure how to do that, to teach them exactly what to do properly. The second part of this will be to educate them as to what the doctor, the physician, should be doing to the woman's breast during an examination. It's a rigorous program to examine the breast properly. We will show them picture-wise exactly what to be doing, what the doctor should be doing, and how they should examine the breast to get a thorough examination of the breast. We then will instruct about mammography, the importance of mammography, and how to negotiate the system to get a mammogram on a routine basis.
You did that beautifully. I couldn't have done it better myself.
Thank you.
Listen, we're going to take a break right now. Understand that you're going to be hearing more about the Confident Woman, and we're going to give you a phone number for those of you who are in our listening audience and nearby to find out how you can get the program in your church. And we're going to talk, or community group.
Right.
Well, it doesn't have to be just a church. We'll come to you. But right now, we're going to take a break. This is WIMG AM 1300, and of course, WZBN Channel 25. And you can always find us on the World Wide Web at WIMG1300.com. Thank you. Evening, and we are back, and this is In the Public Interest. I am your host this evening, Linda Johnson, and with me this evening is Charles B. Simone. He's a doctor here and researcher here in Mercer County. Dr. Simone is our guest. Now, we broke at the break. We were just telling everyone about the Confident Woman program, and we talked just a little bit, just maybe review a little bit about detection.
Sure. The first thing we'll talk about is self-examination. Every woman needs to examine their breasts on a routine basis. Now, it should be at a certain time of the month. For instance, after a menstrual period, on day 2, 3, 4, or 5 of the menstrual period, the woman should then examine their breast, because that's when the breast will be at its lowest fullness. So you want to examine and feel for proper masses and things like that. There's a technique, a good technique, and we'll outline it for them. We'll teach them how to do that. We'll give them handouts. We have it in our book, how to do it as well. But it's a very soft technique. It's done in a circular fashion. It should not be done in a shower with soap. You'll miss things that way. It should be done in a lying down position. After you first examine yourself in a mirror, you need to look at yourself, put your hands on your hips, push down hard. That'll express anything on the top of the breast, and then you lay down and examine yourself. So that's the self-examination.
Okay. Then what about the
physician
doctor's exam?
The physician exam also is an involved period of time. You need about 10 or so minutes to have a proper exam by a doctor. The issue will be to make sure that the doctor does the proper exam with the proper technique. There's 6 different positions that need to be done for the examination.
Okay.
We'll outline that. We'll tell the woman what to do, and we'll have pictures for her as well.
Now, one thing I want to point out for those who are listening and perhaps won't be able to see us, this is also going to be very interactive.
Yes.
One of the things I love about working with Dr. Simone is questions and answers. And it's not just a one-way street. We're going to take questions. You're going to let women ask you things. And we also know there could be things women may be a little shy about. But let me just say, ladies, he's an MD, okay? And if you have the questions, it's going to be the perfect time to get it out there. He is an MD, and I just think it's wonderful that you have come in partnership with the New Jersey Seed Program and coming out and working with us. And I thank, again, Mr. Morris for letting us get it out to the public.
Very kind of Morris Broadcasting.
So we're going to be giving out this information. It'll be a two-way street. They'll be interactive. What about prevention?
Okay. Mammogram also.
Yes.
Third leg
I'm
is
sorry.
mammogram, so we all need to get mammograms on a routine basis. The starting time will vary according to the person, and
Right.
her risks will outline that for them, and the routine interval of time is also going to be defined by us as well. Now, that's the detection part.
Okay.
Now, how do we prevent the disease, and how do we extend the life of a person who has breast cancer already?
Okay.
So we can prevent and extend life at the same time with the same 10 points, same 10-point plan that we've talked about. First point is nutrition. Again, 60% of women's cancers are nutritionally related. So what do we need to do, Linda? Our old friends, we need to avoid the four-legged animals,
Yes.
avoid the shellfish,
Unfortunately.
and avoid the dairy products that come from the four-legged animals. So if you want dairy, it should be non-fat or skim products. So non-fat yogurt, non-fat milk, non-fat ice cream, that's all fine, but that's it. What do we have left? We have two-legged animals, turkey, chicken, and we have swimming fish from the ocean, not the farm. And again, also we have all the things that grow from the earth, fruits, vegetables, and cereals. However, not soy, no soy,
Right.
because that's high in estrogen component.
And I do know that estrogen, at least in my case, is my own worst enemy.
But lots of women's cases are. So we need to avoid estrogen.
So we need to be aware of that. And one other
That's not only
point,
for breast cancer, but it's all prevention, because soy
let
is
me
high
bring
in
up
estrogen.
another point, Dr. Simone, because Dr. Simone and I just had this conversation. What is the largest organ in the body?
The skin.
The skin.
And what do you know about that?
And what do I know? What did I learn? The skin. I was using soy products in my hair
Yeah.
and different things. I thought I was doing all the right things, so let's just be aware. I mean, I didn't go out and just throw everything away right away.
No.
I had to find the right
Read the
product.
labels.
Read the labels.
Read the labels.
I stand up in that aisle, and no matter where I am, but we need to be aware of
Sure.
that, because I happen to know estrogen was one of my factors.
Now, vitamins and minerals. We need to take vitamins and minerals because a study done in 2005 by the USDA showed that fruits and vegetables, determined from 1975 to the present 2004, had much less content of vitamins and minerals compared to 1975. So what we're eating today has far fewer and far less amount of vitamins and minerals. So we need to take a supplement. We need to take vitamin C, vitamin E, vitamin A, beta-carotene, vitamin D, the B vitamins, a good calcium base. We need also fish oils, which are very important to help prevent disease. And we need, believe it or not, aspirin. One aspirin, 325 milligrams, the old-fashioned kind, every other day with a full meal will do a lot of things to help prevent heart attack and stroke, and also the risk from cancer spreading. So simple things to take in addition to your diet is very important for you. That's point one. And there's many more things, but they're the highlights. Point two is no smoking. No inhaling other people's smoke. We know that 17% of all our lung cancers are because of children who inhaled between ages 3 and 15. So stay away from smokers. Point three, alcohol. We touched on it. 2 or 3 drinks a week, not a day, a week, is enough to give a woman a 250% higher risk of breast cancer by itself. By itself. So we have to stop the alcohol. Now we need to exercise. We hate that word. Every American hates that word, exercise. So here's what we should do. Just take a long walk, 20 minutes by the clock, uninterrupted time, 4 or 5 times a week. That's not a lot of time if you think about it. And that will be enough to stimulate the immune system and decrease the risk of cancer of the breast and cancer of the colon. Huge, huge things. Minimal effort, big payoff. And last in our 10 points is really a way to mental relaxation. We need to quiet down our brain on purpose. With our society, television, internet, hustle, bustle, family, this and that, we always get upset. So here are a few ways to calm people down. Take a nice hot shower or a hot tub of water. That calms down the brain. When the brain is calm, the immune system goes up. Or music, the kind you like. Somebody else may not like your music, but if you like it, the brain will calm down. And finally, spirituality. It's a big thing. To be spiritual as a spiritual person, one is more calm and one is more healthy. So these 10 points will do a lot of things. They'll prevent diseases from occurring, breast cancer specifically, because breast cancer is a diet and hormone-specific disease. And it also will help extend the life of a person who already has breast cancer, because it'll do two things. These 10 points, these lifestyle changes, will enhance the immune system and decrease the growth rate of tumor cells. Stop feeding the tumor.
I hear. Now, Dr. Simone, I know we weren't able to show how a physician does the breast the clinical breast exam.
Exactly.
But we are going to make it available on your website.
Yes.
And what is that website?
It's drsimone.com. DRSIMONE. DRSIMONE. drsimone.com.
And we're going to have those pictures so that women understand it's not just blim blam, I'm done. It's
That's
very
right.
involved.
Yes, it is.
And this is a part, ladies, of empowerment.
And in fact, the physician's exam is almost as effective as a mammogram if it's done right.
If it's done correctly.
If it's done right.
Now, I love how we ended this by talking about the spirituality, because a woman's health is one of God's greatest gifts. And we as black women are often seen as caretakers for everyone else. And I think this is a time, especially with the program, The Confident Woman, that we are trying to take care of ourselves. We are the caretakers.
The Confident Woman will really address this issue of education and empowerment.
Empowerment.
Once people are educated, they will feel empowered and they will be healthy.
And you cannot take care of others if you yourself are not healthy.
That's right.
And I think that's something that we agree with. Now, in case anyone is interested in having the Confident Woman program at their location, where can we call?
609-896-2646.
That's 609-896-2646. And one of the things I wanted to bring out about the Confident Woman is this. Although Dr. Simone and WIMG and New Jersey Seed are in partnership, women, we don't care if you're insured or uninsured. We have a program for you. We take Medicare, Medicaid. We want to educate all women. If there's a niche you need to be put in, we're here to help you get it, and we'll help you navigate. That's kind of our goal.
Tell us briefly, we have a few more minutes, tell us briefly what the Confident Woman will help these women. What will they do? What will they have to do in the program?
What they're going to have to do, they'll come in, they'll get educated, they'll get a clinical breast exam by a physician if they choose. They can get a script for a mammogram if they have never had one.
Exactly.
We want to know about their family history, and we can tell them the sites that are available for them to get mammograms.
Exactly.
If they need a buddy, and sometimes you just need a buddy to go with you.
Just a little help.
It's a little help, somebody to help, maybe a little hand holding.
Right.
We have people ready to do that. So ladies, remember, black women, it's your time to be selfish about your health. And that's what the Confident Woman program's about. And if you're interested in having it at your group or organization, it's 609-896-2646. That's the Simone Protective Cancer Institute, and they will hook you up with us to get out there. And don't forget, it's not always 9 to 5. We'll come on Saturdays. We'll come on Sundays. We'll come during church, as long as our schedules permit, and we really try to make it. Now, we're almost out of time, but I always like to leave Trenton people with announcements of what's going on in Trenton. We are actually doing the first